Hello, Namaste. Today MCQ questions which I made wrong or clinical questions like that. Uh, a 60-year-old female with poorly controlled hypertensions present to emergency department with clinical features like headache, blurred vision, and shortness of breath, and her blood pressure is very high. So this is the case of malignant hypertension because we know that the also that there is a 210 by 140 mmHg which is very high. This is the malignant emergent hypertension. On examinations revealed papilledema. Papilledema is a swelling of the optic discs which result from the malignant hypertension. The next question that what is the most appropriate initial management for this patient, like question, you know. That's what is the next management for this, what is most appropriate initial management for this patient. This is initial management for this patient. Okay, then option like that, administrated sublingual nitroglycerins. This is wrong because nitroglycerins is used in angina pectoris, not suitable for this emergency hypertensions. And option B is benign oral antihypertensive medication like outpatient measurement, which is also not suitable because there is a case of emergency hypertensions. And option C is admit the patient to ICU and start IV laboratory. This is correct. And option D, order head CT scan to rule out the intracranial hemorrhage. These two options is correct, but question asks that there is what is the most appropriate initial management for this patient. Initial management of this patient. If there is asks what is the next step management of this patient for long period, then D is correct. But the initial management, so option C is correct. Then let focus on the solution of this question. The question said that in this scenario, patient present with severe symptom, headache, same things, blurred visions, hotness of breath, and elevated blood pressure, which is very high, papilledema, indicate end organ damage. Okay, as so suggests hypertension emergency. The most appropriate initial management to admit the patient to ICU. Okay, and intravenous anti-hypertensive medication because it's initial treatment question asked. So for initial treatment of the such as hypertensive emergency, other medication is like nitroprusside, nicardipine, labetalol, including labetalol, which is also seen in question. Admit the patient to ICU, start labetalol, and and another drug like used in malignant hypertension is same things, stroke, myocardial infarctions, acute left ventricular failure, aortic dissection, that's labetalol, ismolol, nitroprusside, and adenosine crisis, phentolamine nitroprusside. Okay, and why option A is incorrect? I told that in initially because this is a case of the emergency hypertensive crisis, so there is not use sublingual nitroglycerins, and benign oral anti-hypertensive medications at outpatient management also not use. And third option is order CT scan to rule out intracranial hemorrhage is correct, but is initial not initial treatment. That's why this is not correct according to questions. And this is a question of the day. Thank you.